Hi, my name is Aida Tinoco. My topic is hypoparathyroidism complications. Definition. It is a rare condition that occurs when the parathyroid glands in the neck do not produce enough parathyroid hormone. There are four parathyroid glands located near or behind the thyroid gland. The main functions of the parathyroid hormone is to regulate the level of calcium in your body. It also controls the level of phosphorus and has a role in the production of the active form of vitamin D. All of these activities are necessary to maintain calcium's balance.
We'd like to tell you about the rare condition hypoparathyroidism. Hypoparathyroidism arises when the parathyroid glands are unable to perform their function. There are normally 4 parathyroid glands found on the thyroid at the back of the neck. These glands secrete parathyroid hormone, PTH, which circulates around the body and regulates the amount of calcium in the blood and bones. PTH secretion is regulated by a feedback mechanism. When the level of calcium in the blood is too low, the parathyroid gland secretes more hormone, which stimulates the increase of the calcium levels in the blood, and vice versa. PTH also regulates phosphate levels in the blood. By decreasing the amount of phosphate reabsorbed by the kidney, calcium and phosphate have several important jobs, including building strong bones and teeth, and regulating muscle contractions such as the heartbeat. Damage to the parathyroid glands during neck surgery is the most common cause of hypoparathyroidism. It may also be due to genetic or autoimmune causes. People with this rare disease don't produce enough PTH, which causes low calcium levels in the blood. This causes a variety of symptoms, including fatigue, seizures, irregular heartbeat, numbness, tingling and twitching of muscles, and impacting mental clarity or brain fog. Hypoparathyroidism can have a significant impact on a patient's daily life, even sometimes preventing them from working or interacting socially. Not many people know about this condition, which can make those living with it feel isolated and alone.
Applications in medicine. Post-surgical hypoparathyroidism. It is the most frequent cause. It appears as a result of accidental damage during surgery, autoimmune disease, hereditary hypoparathyroidism, when the patient is born without parathyroid glands or they do not work properly, low levels of magnesium in the blood, which can affect the functions of the parathyroid glands.
Hypoparathyroidism is a rare endocrine disease that occurs when low or inadequate levels of parathyroid hormone, or PTH, are secreted by the parathyroid glands in the neck. The most common cause is injury to the parathyroid glands during neck or thyroid surgery. The condition is considered chronic when low levels of calcium and PTH persist for at least 6 months after surgery. Symptoms can include fatigue, muscle cramps, tingling and twitching of muscles, brain fog, anxiety, and reduced quality of life. More serious complications, such as cataracts, ischemic heart disease, and impaired renal function can occur in chronic hypoparathyroidism. Standard therapy includes calcium and vitamin D supplementation. However, some people remain symptomatic despite treatment and may require higher doses. There are concerns about the prolonged use of higher doses, particularly with regard to hypercalciuria or increased urinary calcium, kidney stones, nephrocalcinosis, and declining renal function. ESE guidelines now suggest considering monitoring of urinary calcium excretion at regular time intervals over a 24-hour period. PTH is critical in maintaining mineral homeostasis in the body through its effects on bone, kidney, and the intestine. As part of this process, the kidney plays a central role in regulating renal calcium absorption and phosphate excretion and activating vitamin D. Abnormal serum calcium concentration, hypercalciuria, and increased phosphate and calcium phosphate concentration increase the potential for serious comorbidities. It's not fully known what causes the long-term effects of hypoparathyroidism on the kidneys, and whether this is due to severe or long-term disease progression, standard treatment, or both. Further research is needed to understand exactly how hypoparathyroidism causes long-term kidney complications. New and continuing clinical research is expanding our scientific and real-world knowledge of this. With an extensive program of life sciences research and long-term data generation, Shire, as a leader in rare diseases, is committed to making a meaningful difference for people with conditions such as chronic hypoparathyroidism.
Pros and cons. Pros: accurate diagnostics and treatment might prevent these complications associated with hypoparathyroidism. Cons: once it occurs, calcium and vitamin D won't improve protein. Issue applied in Ecuador. Ecuador is not an endemic area for this disease, but an early diagnostic will help us prevent complications in people who suffer it. There are no official statistical data on this pathology, however, citing several local studies. The prevalence in Ecuador is low compared to other countries and is often seen in older people and pregnant women. Conclusion: hypoparathyroidism is a care entity. It most commonly occurs as a complication of anterior neck surgery. It can give us a series of complications if not treated in time. Can turn into a serious health problem. An early diagnostic will be the initial goal in these patients. Hypoparathyroidism does not have a high prevalence in the equator, but the most affected populations is the elderly and pregnant women. Thanks.